Good day. I am Dr. Bibiano Reyes Jr., a pediatric pulmonologist. In our institution, I will be discussing pneumonia in children. For this lecture, we will accurately diagnose pneumonia in children based on current guidelines given a clinical case scenario. Properly manage a child with pneumonia based on current guidelines given a clinical case scenario. Pneumonia causes 3 million deaths among children in less than 5 years worldwide. It causes 154 million out of 158 million new episodes per year in developing countries. In the Philippines, it ranks third in the 10 leading causes of mortality and morbidity in all age groups. Pneumonia can be defined as inflammation of the parenchyma of the lungs. It can be classified to community-acquired pneumonia, nosocomial aspiration, pneumonia in immunocompromised children, and recurrent pneumonia. Etiology of pneumonia can be due to infectious or non-infectious. For the infectious, it can be due to virus, bacteria, mycobacteria, fungi, and parasites. For the non-infectious, it can be due to aspiration, inhalation, foreign bodies, hypersensitivity reaction, drug or radiation induced. These are the common organisms causing pneumonia in children based on different age group. Kindly read on them. Physiologic defense mechanisms of the lower respiratory tract are usually due to cough reflex, mucociliary clearance, immunologic defense mechanisms. Inflammatory cytokines mediate the immune response to invading pathogens. These are the typical signs and symptoms of a child with pneumonia. It may be due to general, specific, and the signs are usually commonly, cough and sputum production in children. These are the different features of bacterial, viral, and atypical pneumonia in children. Please read the different parameters and kindly read on it and know the difference between the different organisms. A chest X-ray is very important. It confirms diagnosis, indicates complication, and provides etiology clues. These are other laboratory procedures that can help you diagnose pneumonia in children. These are the clinical practice guidelines created by Philippine Pediatric Society to help us diagnose a child with pediatric community-acquired pneumonia. There are 4 categories: minimal risk, low risk, moderate risk, and high risk. The parameters on the left will guide you to what category your patient will be diagnosed. For example, if all parameters based on the left fall on PCAP B, you diagnose a child as having PCAP B. However, if only one parameter exceeded on the right, like for example, most parameters fell on PCAP B, but you noted the child has moderate dehydration, Then you classify the patient as PCAP C instead of PCAP B. Another example of the guidelines, kindly read on this. WHO defined tachypnea for less than 2 months as having more than 60 breaths per minute. For 2 months to 12 months, more than 50 breaths, and for more than 1 year old at 40 breaths per minute. This table will guide us on what proper antibiotics to be given in a child with PCAP. For PCAP A and B, we give oral amoxicillin as the drug of choice. For PCAP C, we give penicillin or ampicillin. And for PCAP D, we must refer to the specialist. If the child is not improving in the present antibiotics given, you now have the option of shifting antibiotics within 72 hours. For example, you started for PCAP A, you gave amoxicillin. If there is no improvement, you have to upgrade antibiotics like giving cefurexime and amacrolide. Kindly read on this table for other PCAPs. In the treatment of viral pneumonia, there is no role for antibiotic therapy. 30% of patients with known viral infection have coexisting bacterial pathogens. Antibiotic therapy should be initiated when deterioration in the clinical status is observed. This table will guide you on what antibiotics to be given on a mildly ill child and hospitalized child. Complications of pneumonia may lead to pleural effusion, empyema, pulmonary abscess, pneumothorax, atelectasis, and bronchiectasis. In summary, we have presented the PPS clinical practice guidelines on PCAP, showing the different parameters and the proper antibiotics given on what category, and indicated what antibiotic to shift if there is no improvement within the next 72 hours. Thank you very much.